Hi, I'm Dr. Bhavana Girish. I'm a reproductive medicine consultant at Motherhood IVF and Fertility, Banashankari, Bangalore. Today I'll be talking about an introduction to IVF, basic overview of in vitro fertilization. So IVF or in vitro fertilization is a process where we extract the gametes, the egg from the female partner, the sperm from the male partner, and then we fuse these two in the lab to form an embryo. This formed embryo is then allowed to grow in the lab for a few days, after which it is placed back inside the uterus. Infertility or inability to conceive naturally is defined as if you have been trying to conceive naturally for a period of at least 1 year. 1 year unprotected intercourse on a regular basis and you've still not conceived, that is when you have to go meet a fertility specialist. So above 35, if you've been trying for 6 months, you should go and meet a fertility specialist. Or if you are also suffering from some conditions which are known to cause infertility. For example, you have irregular periods, you have PCOS, you have endometriosis, you have fibroids in your uterus. These are all conditions which can hamper your chances of getting pregnant naturally. An IVF cycle has 5 basic steps that we need to go through. The first is the pre-cycle preparation. So the second step is ovarian stimulation. The next step will be the egg retrieval process or the ovum pickup process. Fourth step, that is called as ICSI or intracytoplasmic sperm injection. And our last step is the embryo transfer. Overall, we have 2 basic types of infertility, primary and secondary. Primary is a woman who has never conceived before. No miscarriages, no abortions, never had a pregnancy test positive in the past. Secondary infertility is less commonly seen, but this is also something which may need IVF in certain cases. A secondary infertility is if you have had a pregnancy before. It may be a natural pregnancy, it may be an IVF pregnancy. And this may have been a full delivery or an abortion or an ectopic. Any sort of pregnancy you've had in the past and then you're not able to get pregnant a second time around, you are considered to have secondary infertility, and this may also be an indication for IVF. In terms of pain, the pain scale of this is about 0 or 1. So you are able to carry out all your regular activities, including going to work, your household chores. Everything can be done even during an IVF cycle. IVF today is a very safe process. Now science has advanced to a good enough level that we are able to eliminate almost all major side effects of IVF. It is a relatively painless and extremely safe procedure.